Ms. Tripoli, what steps can be taken to improve patient choice past the initial step of improving transparency?
Well, I think part of the focus, obviously, of this hearing is talking about how we can empower consumers and patients, employers, workers with more information to make more informed decisions. Price transparency, not only for hospitals and for plans, but across the entire healthcare system, transparency of information is going to be critical to unveil the curtain of what is happening underneath the system that's driving unaffordable care and low quality care, frankly. So I think price transparency for sure for hospitals and plans, also many of these provisions, obviously in the Lower Cost, More Transparency Act, enacting site-neutral payments, which gets underneath the hood if the healthcare system takes on this broken financial incentive. That allows consumers to have, whether you're in Medicare or you're in the private market, to have more affordable care options. Those are probably two of the most important provisions that this committee has advanced through this legislation.
How can we ensure we build out care options in medically underserved communities where there's less financial incentive to provide services in that community?
I think it's a balance. We have to make sure that the community-based providers that are in these communities are financially sustainable. We have to make sure that the markets function for them. We have to make sure that care is affordable and that the people that they are designed to serve have options, have choice. And that is there are a whole variety of policy solutions that we need to address to make sure that people in communities have access to what they need.
And how do the, quote, broken financial incentives you mentioned in your testimony disproportionately fall on the backs of poor communities and communities of color?
I think consolidation in the healthcare system affects every single community across the country, and the way that the involvement of private equity in mergers and acquisitions and the impact that has on reducing wages, on reducing access, even closing the doors of certain hospitals has a direct impact on some of the communities who are most hard hit, who need services the most. So we have to have a holistic approach when we're thinking about making sure we have access for all.